if your finger's locking or jamming, something definitely is wrong. You possibly might have trigger finger. Trigger fingers happen because your tendons get stuck. Well, we all know that the fingers move because you have got tendons which are connected to the muscles. So when the muscles contract, it pulls on the tendon and the fingers close. These tendons run through tunnels below the skin. Now the tunnels are good because it doesn't allow the tendons to move around, but it's bad in the sense that they are very narrow tunnels, and in some cases when you have been doing lots of repetitive gripping and rasping, the tunnels become sore, and when they get sore, they get tight, and when they get tight, every time the tendon passes through, it catches on the tendon and the tendons get stuck. So you can actually see your finger getting stuck, and when you try to open it up, it flicks open. So that's what you usually call up as a trigger finger. Trigger finger can happen to anyone, but it's most common again in ladies. It happens more in the fifth decade. It can happen more commonly amongst patients who are diabetic or have kidney problems, but it can happen to anyone. What you usually say that 80% of cases, trigger finger happens because of no reason at all. In the early stages, you might actually see your fingers flicking, and it's usually accompanied by pain around this area, basically at the base of the finger. Now, if you're catching it early and you're feeling that you have a trigger finger, there are some ways of actually stopping it from progressing further. We usually advise our patients that you can massage around here, along with regular stretching of the finger backwards. Now, when you do that, that stretches up the tunnel and allows it to spread out and stop catching the tendon. Now, if that doesn't get better, it's time to see the doctor. Usually we start off with the conservative management. It usually is a combination of few things. One, the massage as we told you right now, plus wearing a thimble or a splint which will stop the movement of the finger for around 4 to 5 weeks. Along with that, we usually recommend going and visiting our therapist who can do some ultrasound therapy or targeted laser therapy around this area, which usually helps with reducing the inflammation. If it is of a very severe grade or a medium severity grade, we usually recommend a steroid injection. It goes inside and reduces the inflammation and allows the swelling to disappear, which actually is the problem. Now, if that doesn't work, or you want an instantaneous solution, we have surgery. Surgery is very simple. We usually give a local anesthetic injection around here, make about a 1 centimeter cut, go down to the tunnel, split it open. Now, if you split open the tunnel, there's nothing catching on your tendon anymore, and you won't be having any more locking thereafter. Imagine a scenario, you're driving and your fingers get locked while your hands are on the steering wheel and you need to change your gear. You won't be able to do that, and that is technically dangerous. A lot of scenarios like this might crop up in your day-to-day life. So we would suggest that if you have trigger fingers, do not take it lightly, do visit a hand doctor, get it sorted out.